Hello everyone, welcome back to Made Easy Nursing. This is the part 3 of our ABG Analysis series and the last part. And today we will be discussing important ABG based question answer. Okay, if you are new here, I'll highly recommend you to check our part 1 video where I have discussed the basic concept of ABG Analysis, and in part 2 videos I have discussed how to interpret the values and the type of compensation, like whether it is full compensation, partial compensation, uncompensation, how to identify those kind of compensation, and much more in the simplest way possible. Now let's dive into today's sessions and test our understanding with some real-time question answer discussion. Okay, so before proceeding to today's sessions, again I will be discussing the basic component and their values like pH, pCO2 and your bicarbonate. Okay, so the basic normal ranges of pH is from 7.35 to 7.45. The normal ranges of pCO2 is 35 to 45, and normal ranges of bicarbonate is from 22 to 28. Where I told pCO2 is an acidic oxide, that means it is acidic in nature, and bicarbonate is basic in nature. Okay, now pH value ranges from 35 to 7.35 to 7.45, where 7.40 is absolute normal values. So whatever values is towards your right side, that means more than 7.40, will be considered as basic or leading towards alkalosis, and whatever values is getting towards your left side, that means less than 7.40, will be acidic in nature and leading towards acidosis. So that value can be 7.39, can be 7.32, can be 7.1, 7.2, whatever is less than 7.40. Okay, so then coming to your pCO2 value. pCO2, I told you normal ranges is from 35 to 45, and pCO2 is acidic oxide, that means acid in nature. Okay, so whatever values is beyond 45 means acidic component is getting increased, so it is leading towards acidosis, and whatever values is leading towards your left side means less than 35 means acidic component is getting decreases. So alternatively we can say it is leading towards alkalosis. So when we will say it is acidosis, when the pCO2 value is more than 45. When we will say it is alkalosis in case of pCO2 alternation, when the pCO2 value is less than 35, as is acidic component is getting increases. Now coming to your bicarbonate value. So bicarbonate is basic in nature and normal value is from 22 to 28, and it is basic in nature. So whatever values is getting towards your right side, that means more than 28, that means basic component is getting increases, so it is leading towards alkalosis. And whatever values is leading towards your right side, that means it is getting less than 22 means basic component is getting decreases. We will say alternatively it is leading towards acidosis. So in case of bicarbonate alternation, when we will say it is acidosis, when your bicarbonate value is less than 22, as because basic component is getting decreases. Basic component decreases means alternatively acid component is increases. When we will say it is alkalosis, when your bicarbonate value is more than 28 means basic component is getting increases. Okay, now coming to your question answer discussion. So here let's think you are attending one question exam paper, and in this exam question came like this. ABG values given as 7.32, PCO2 given as 50, and your bicarbonate given as 24. So we will write it here again. pH 7.32, PCO2 given as 50, and your bicarbonate given as 24. And you know pH values normal ranges from 7.35 to 7.45. PCO2 normal range is 35 to 45, and bicarbonate normal range is 22 to 28. So you don't know anything about how to answer this question. Now you will written as answer, okay? So I told you, you have to think about whether the first step will be whether it is acidosis or alkalosis. So how you will know that? So you will draw this line of pH 7.35 to 7.45, where 7.40 is absolute normal value and pH value given as 7.32, means it is 7.32 is less than 7.40, right? That means it is leading towards your left side. Left side means it is getting towards acidosis. 7.32 means somewhere it is here, right? So what I told earlier, your pH value, if it is leading towards your left side, that means less than 7.40, it will be acidosis. So did I get my answer? Yes, it is a case of acidosis. Now we have to find out whether it is due to your respiratory problem or metabolic problem. So for being acidosis, what I told, PCO2 value should be more than 45. PCO2 value, okay, PCO2 value should be more than 45, or bicarbonate value should be less than 22, because here I discuss for being acidosis, PCO2 value should be more than 45 and bicarbonate value should be, second criteria should be less than 22. So this criteria is fulfilled by PaCO2 or bicarbonate. Let's check. So PCO2 value given here as 50. Did this criteria fulfill by PCO2? Yes, of course, as 50 is more than 45. Now we will check this bicarbonate value. Bicarbonate should be less than 22 for being acidosis. What bicarbonate value given in question paper? It is 24. So did bicarbonate fulfill this criteria? No, because bicarbonate is in normal range between 22 to 28. Means here as it is given 24, so it is in normal range. So patient is not having any metabolic problem. So patient is getting acidosis because of your respiratory problem, as this PCO2 value increases to 50, where the normal ranges is from 35 to 45. I hope it's clear now. So it is a case of respiratory acidosis. So where is your option of respiratory acidosis? Here I can see in option C, it is respiratory acidosis. Now what it is written in bracket uncompensated? Why I am saying why it is uncompensated? Because see here your PCO2 value given in question paper 50. That means patient's PCO2 value is getting increases. So bicarbonate should alter its value, means bicarbonate also increase its value to compensate this alternation. As I told earlier, in your body this acid and base always in maintaining a equilibrium state to maintain a static environment. If acid will increase, base will also increase. If acid will decrease, base will also decrease. As here PCO2 is increased, so base should increase, means bicarbonate should increase its value to maintain this equilibrium state. But here this bicarbonate not even change its value, as it is not even change, or it doesn't care about the changes of PCO2 value. That's why it is a case of uncompensated respiratory acidosis. So here is the answer is respiratory acidosis. Option C is your answer. I hope it's clear. Now coming to the second question. Here in this questions it is saying measurement of arterial blood gas where pH value given as 7.5, PaCO2 given as 40 and your bicarbonate given as 34. Now what kind of ABG abnormalities is this? So don't look into this option. First we will simplify the answer, okay, in step by step. Here we will written as answer. Now what I said, first after getting this data we need to check whether it is a case of acidosis or alkalosis. So we will write the normal ranges of pH and PCO2. So normal ranges of PCO2 pH is 7.35 to 7.45. PaCO2 normal ranges is from 35 to 45. So it is in normal range. 40 is between this range only. So it is normal range. Okay. Now bicarbonate normal ranges is from 22 to 28. But here it is increase. Bicarbonate is increase. Okay. Increases its value. Now coming to the pH. pH it is here given as 7.5, right? Where 7.40 is absolute normal. But given as 7.5 means it is leading towards your right side. Towards right side means getting basic in nature, means it is leading towards alkalosis. Did you get my point? If the pH value is more than 7.40, it will be alkalosis. If it is less than 7.40, it will be acidosis. As your 7.5 is more than 7.5, what it is mentioned here is more than 7.40, it will be alkaline in nature or alkalosis. So in option A, it is written as acidosis, so it won't be the answer. In option A, it is as alkalosis, it is written here. In option B also, so C also alkalosis, option D also alkalosis. So answer can be A, C, D, but not B, as it is acidosis mentioned. So again, our first step we cleared, it will be alkalosis. It is the first step. Okay. Now we will check it is compensated or uncompensated. I told in the part 2 session, if the pH value will be in normal range, we will say it as full compensation. But here in pH value is 7.5, so it is not in normal range, as the normal range is 7.35 to 7.45. So it is not a case of full compensation. Okay. So it can be partial compensation or it can be uncompensation. Okay, partial compensation or uncompensation. So I said, if for being partial compensation, pH, PCO2 and your bicarbonate, all three values won't be in normal range. And for being uncompensation, pH won't be in normal range, but PaCO2 and bicarbonate, one of their value will be in normal range. If PCO2 value will be in normal range, then bicarbonate won't be in normal range. If PCO2 won't be in normal range, but bicarbonate will be in normal range. So let's check which one is in normal range, which one is not in normal range. So PCO2 here is given as 40. So whether PCO2 is in normal range? Yes, it is in normal range, 35 to 45. So here is this criteria is, I'm getting like it is fulfilling. And bicarbonate is in normal range? No, it is not in normal range, as the normal ranges is from 22 to 28. So I'm getting like bicarbonate is not in normal range. Okay. See, bicarbonate not in normal range, but PCO2 is in normal range. So it can be an example of uncompensation. Again, we will simplify. Okay, now it is alkalosis in nature, and that alkalosis, for being alkalosis, two criteria should be fulfilled. Bicarbonate will be more than 28 or PCO2 will be less than 35. So what criteria is fulfilled here? See, bicarbonate should be more than 28 and here it is written as 34. So bicarbonate is fulfilling the criteria, and PCO2 should be less than 35, but here it is more than 35, that means 40 mentioned. So PCO2 is not fulfilling this criteria. So as it is alkalosis, and this alkalosis being alkalosis, bicarbonate is fulfilling the criteria, that means base is fulfilling the criteria, and bicarbonate is responsible for metabolic problems. So this is a case of metabolic alkalosis, as the bicarbonate is PCO2 is in normal range, so it is not due to the respiratory problem. Now whether it is a case of full compensation or partial compensation or uncompensation, as this pH not in normal range, PCO2 is in normal range, and bicarbonate is not in normal range. So it is a case of uncompensation, as bicarbonate value is more than 28. So PCO2 should increase its value to compensate the alternation, but here PCO2 अपने normal range पे ही है. So here it is not even compensating the alternation. That's why it is a case of uncompensated metabolic alkalosis. What will be the answer here? Uncompensated metabolic alkalosis will be the answer. Option C will be the answer. Coming to the next question. So in the next questions, it is saying that Carl, an elementary student, was rushed to the hospital due to vomiting and a decreased level of consciousness. The patient displays slow and deep Kussmaul breathing. Kussmaul breathing seen in case of diabetic ketoacidosis. Remember, diabetic ketoacidosis is an example of metabolic acidosis. So I can get hints like it can be an example of acidosis. Now again, he is lethargic and irritable response stimulation. He appears to be dehydrated. Obviously, he will be dehydrated as continuous vomiting is there. His eyes are sunken and mucous membrane are dry. And he has 2-week history of polydipsia, polyuria and weight loss. So it is an example of patient is suffering with diabetes. So now measurement of arterial blood gas shows pH value 7.0 pH value. Normal value is 7.35 to 7.45. As it is less than 7.0 is less than 7.35, it is leading towards left side, means it is acidosis in nature. Okay, PCO2 value given as 23 and your bicarbonate value given as your 12. So for B, we already got the first step answer. It is acidosis, and also in question it is given one hints that it is a case of metabolic acidosis. So obviously it will be acidosis answer, and pH also given 7.0. That means it is less than 7.40. So it is a case of acidosis. So our first step already cleared. It is an example of acidosis. Now this acidosis, for being acidosis, 2 criteria should be fulfilled. One will be PaCO2 more than 45, and second criteria should be bicarbonate less than 22. Now again I told in question given one hints that it is a case of metabolic acidosis, means metabolic problem is there. So PaCO2 value won't be the reason of being acidosis. So again we will check whether the PaCO2 value more than 45 given here or mentioned here. No, PaCO2 value given as 23. So it is not more than 45. So PaCO2 is not the reason for being acidosis. We will check whether the bicarbonate value given less than 22. Yes, here bicarbonate value given as 12 means it is less than 22. So that is the reason for being acidosis. So it is a case of metabolic acidosis. Now whether it is uncompensated or compensated or full compensation, as pH value 7.40, that means it is not in normal range. So it is not a case of full compensation. Okay, now we will check whether it is partial compensation or it is uncompensation. Okay, for being partial compensation, pH won't be in normal range, PaCO2 won't be in normal range, and your bicarbonate won't be in normal range. And in case of uncompensation, pH won't be in normal range, PaCO2 can be normal range. If PaCO2 in normal range, then bicarbonate won't be in normal range. If PaCO2 won't be in normal range, bicarbonate will be in normal range. So let's check which criteria is fulfilled here. So here PaCO2 is not in normal range. So here this criteria is fulfilled by both. Okay. Now PaCO2 not in normal range. So here also it is not in normal range. And here also if we take this one, so here both are fulfilling this criteria. Bicarbonate not in normal range, But here, if it is fulfilling by this criteria, bicarbonate should be in normal range. But here, bicarbonate not in normal range, so we won't think about this uncompensation. So this is a case of partial compensation. So did you get your answer? Yes, it is a case of partial compensation, partially compensated metabolic acidosis. So where is your option in these questions? Partially compensated metabolic acidosis, here in option D. So option D will be the answer. Okay, now coming to your fourth questions, where it is mentioned the pH value is 7.6, where the normal ranges is from 7.35 to 7.45, as 7.6 is more than 7.40, so it is alkalosis. Okay, now PaCO2 given as 31 and it is not in normal range, and bicarbonate given as 25 and normal value is 22 to 28, so it is in normal range. So as for being alkalosis, two criteria should be fulfilled. One will be PaCO2 less than 35 and bicarbonate, second criteria is bicarbonate should be more than 28. So let's check which criteria is fulfilled by this value. So here PaCO2 31, that means it is less than 35. So PaCO2 fulfilling this criteria. Bicarbonate should be more than 28, but here it is given 25, that means it is in normal range. So it is not fulfilled by bicarbonate values. So bicarbonate is not fulfilling this criteria. So it is an example of respiratory alkalosis, whether it is partially compensated, full compensated or uncompensated. So first we will eliminate the option. It is a case of respiratory alkalosis. So respiratory alkalosis is given in option A, and respiratory alkalosis in other option it is not even mentioned the respiratory alkalosis. So all option I can eliminate. So like this way also you can answer in exam. So here I am getting this option A as a right answer. Okay, now again we will check whether it is a case of uncompensation, partial compensation or full compensation. For being compensation, full compensation, pH should be in normal range, but here pH is not in normal range, so it is not a case of full compensation. For being partial compensation, all value won't be in normal range, but here bicarbonate is in normal range. Okay, so it is not a case of partial compensation. For being uncompensation, one value will be in normal range and another two value won't be in normal range. So here this criteria is fulfilled. So that is a case of respiratory alkalosis uncompensated. Okay, now coming to our last questions, where it is saying a nurse is reviewing the ABG result of pH 7.28. So normal value is 7.35 to 7.45 and 7.28 is less than 7.35. So it is a case of acidosis and PaCO2 is 55. So for being acidosis, two criteria should be fulfilled. PaCO2 must be more than 45 and bicarbonate must be less than 22. So let's check the bicarbonate value, where the bicarbonate is 26. That is absolutely in normal range, as the bicarbonate value is between 22 to 28. So this acidosis is the reason for PaCO2's alternation, as it is more than 45 and it is given as 55 here, means acidic component is increases due to PaCO2 value. So it is a case of respiratory acidosis. Patient is suffering with some respiratory problem. So what will be the best nursing action? See, as in your body PaCO2 value is getting increased, we will tell the patient to inhale and exhale deeply. That means deep breathing exercise. Why we will say patient to do deep breathing exercise? In case of deep breathing exercise, we will inhale more amount of PaO2 and we will exhale more amount of PaCO2. I mean CO2 we will exhale. So as a result, what will happen? CO2 will excreting from our body and PaO2 means oxygen will be getting into our body. As a result, PaCO2 will get decreased and it will be compensated. So that's why the answer will be here encourage deep breathing exercise. Okay, so A will be the answer. So that's all for today's questions answer discussions on ABG analysis. I hope these sessions help you revise and apply everything we covered in part 1 and part 2. If you found this helpful, don't forget to like, comment and share with your friends. And so tell me in the comment sections if you want more question based discussion session, and if you have any doubt you can put on comment. Okay, so till then, take care and all the best for your preparation. See you in next video. Thank you guys.